Good day, everyone. My name is Generosa Macaroy, a Bachelor of Elementary Education second year student of Norso Shaton campus. Today, I will be discussing the speech impairment and multiple physical impairment. What is speech impairment? A speech impairment is a condition in which the ability to produce speech sounds that are necessary to communicate with others is impaired. Speech impairments can be mild, such as occasionally mispronouncing a couple of words, to severe, such as not being able to produce speech sounds at all. People who have speech impairments have a hard time pronouncing different speech sounds. They might distort the sounds of some words and leave other sounds out completely. Speech impairment happen for different reasons, such as muscle weakness or problems with the brain. So, as a future educator, we need to know more about our student, especially for those who has a problem regardless of this, because they need extra support like speech therapy to help them improve their communication skills. So it is important for us to be patient and understanding and to treat everyone with respect and kindness regardless of their speech abilities. There are three general categories of speech impairment. First is fluency disorder. This type can be described as a continuity, smoothness, rate, and effort in speech production. Having a fluency disorder means you have a trouble speaking in a fluid or flowing way. You may say the whole word or parts of the word more than once, or pause awkwardly between words. This is called stuttering. You may speak fast and jump words together, or say often. This is what we call cluttering. The second one is voice disorder. A voice disorder means you have an atypical tone of voice. It could be an unusual pitch, quality, resonance, or volume. People develop a voice disorder for many reasons. A voice disorder is a change in how the voice sounds. Healthcare providers trained in ear, nose, and throat illnesses and speech language pathologists diagnose and treat voice issues. The third one is articulation disorder. Inability to correctly produce speech sounds or phonemes because of imprecise placement, timing, pressure, speed, or flow of movement of the lips, tongue, or throat. So, for example, if a child has a articulation disorder, they can't make the R sound and say wabbit instead of rabbit. Another example, the sound of S instead of S, they pronounce F or TH. The last impairment is multiple physical impairment. Multiple disabilities means a student has more than one serious disability which may affect mobility, behavior, emotion, or sensory abilities. Okay, so some examples of multiple physical impairments include cerebral palsy. It affects muscle control coordination. Then muscular dystrophy means progressive muscle weakness, or spinal cord injury, which means impairs mobility and sensation. Some characteristic challenges of individuals with severe multiple impairments are: first, limited communication or speech impairment; second, problems with physical mobility and cognitive impairments. When we say limited communication, it is difficulty expressing or understanding spoken language due to neurological or developmental factors. The second one is problems with physical mobility. These difficulties can include difficulty walking, balancing, or using lines, and may require assistive devices or accommodations to improve mobility and independence. And the last one, cognitive impairments. It refers to difficulties in cognitive functioning such as memory, attention, problem solving, or language skills caused by neurological conditions and brain injury. Now let's proceed to the teaching strategies for students with multiple physical impairment. Letter A, know the needs, play to the strengths. Each student with multiple disabilities will have his or her own set of skills, strengths, and learning needs. Learning more about this ability of the students will be helpful in addressing those learning needs. In addition, as a future educator, we have to find out more about the student's strength, interest, and preference. This can be used to motivate the students and enrich the education that he or she will receive. Letter B, make modifications. Students with multiple disabilities often need substantial modifications and accommodations in the classroom. This will help them access the general education curriculum at a grade-appropriate level. Letter C, allow partial participations as necessary. Partial participation means that the students with multiple disabilities are not excluded from activities because they might not be able to complete the task fully or independently. Modifications can be made to the task itself or to how students participate. The last one is practice and reinforce. Teachers should be concrete in anything. Give lots of hands-on opportunities for learning practice. Okay, so practicing and reinforcing skills for the students with multiple physical impairments is important because it can help them develop and maintain their physical abilities, and of course, it can enhance also their overall well-being. Speech impairment and multiple physical impairments can significantly impact an individual's ability to communicate and perform daily activities. These conditions can cause challenges in speaking, moving, and interacting with others. It is important to provide appropriate support and accommodations to enhance their quality of life and promote inclusion and accessibility. That would be all for today, and I hope you learned something from today's discussion. Thank you!